And so, Julie Cortez, copywriter by day, freelance rock star by night. I live, breathe, teach, speak, and coach on all things freelancing. And welcome to the Freelance Rockstars Meetup. And today we are talking all about health insurance. Just a couple of pieces of admin before we get into that. Please remember that the Freelance Rockstars group is completely different than the Freelance Exchange of Kansas City. I know I'm at the helm of both of them. I know it's confusing. You are not the only one to get confused by that, but we are two different animals. First and foremost, the Freelance Exchange is just for Kansas City. And then, as I mentioned before, the Rockstars is nationwide and international, really. We have people from all over the world in there. So we're all virtual in the Rockstars group, and it's all about community and collaboration, commiseration. I'll come up with another C here, creativity, right? And the Rockstars group. Also, if you missed it, I am now hosting the replays of these sessions on my YouTube channel. I have a playlist set up, so if you ever want to go back and see what you missed, or you can't make it, I'm going to give you the link there in the chat, so you have it. Never miss a thing. Okay. So now we get to talk about the fun thing about health insurance. I know it's everybody's favorite topic, and I know it can be confusing. I know it can be expensive, and it's even seems to be more complicated when you're self-employed. So that's why we're here today, to have these open and honest and real conversations about health insurance. Um, I want to make a little disclaimer here. I know people have political opinions about this very topic, and I want to make sure that we keep it professional for the sake of the Rockstars group, and we keep those political opinions aside. I may very well agree with you on those opinions. However, today we're going to keep things professional. So I trust that you will help me do that, and we'll keep this a safe space for everyone. Okay, good. Thumbs up on that? Yes, okay. All right, cool. So today I'm hoping we can swap stories. We can share different strategies, what's worked, what hasn't worked, what's on tap for the future, what our options are going forward. And of course, we have Mary here to help answer any questions that we may have that goes beyond my scope or your scope. Um, but I do want to throw out some things. You all kind of talked about it in your intros, but let's just do a quick show of hands so we can see visually where people are getting coverage from. So if you're currently getting, if you have a full-time job, are you getting, who's getting insurance from a full-time employer? Anybody? Anybody? Okay. Who is getting it from a spouse or a parent? Okay. Okay. Who is getting it from the ACA, from the marketplace? All right. And then is anybody uninsured on the call? Okay. All righty. I do know one of our rock stars mentioned in the group, we did a questionnaire the other day, if you will, and she mentioned 316 insurance. I've never heard of that. So I'm not sure, but there are obviously other options. You could go through, just any of the regular Blue Cross Blue Shield, for example. We, as the Freelance Exchange of Kansas City, have looked into health insurance, but unfortunately, because we don't have that employer-employee relationship, we are unable to offer health insurance. However, there are places where you can go to get this help. And there are different organizations that offer dental insurance and vision insurance, and why they are not all connected still blows my mind because they should be, right? So we're going to talk about all of that today. But I do want to open up the floor first to you all about your questions. Anybody got a hot burning question? Instead of what do we do?
So, I'm an LLC, a disregarded LLC, so it's slightly some protection there. But I heard someone say for tax purposes that my LLC should be buying my health insurance and then providing it to me as Dennis. But I didn't know if an LLC gives you more options to have a company purchased insurance as opposed to I'm just an individual.
Can I chime in there for that? So if you worked with Sunflower Benefits Group, everything that we offer is going to be full coverage. It is going to be something that you can incorporate as an independent entrepreneur. So if you have an LLC, we have an option for you to be able to do a group all the way down to one. And Ron, you could do this too. So, where you have each employee. So if you're a group of one, it's just you, can fill out a personal health questionnaire and you'll get a quote back. It is a full, Affordable Care Act compliant insurance policy. So it acts the same way. And the pricing will be based on your personal health questionnaire. So, it's going to be how healthy are you and how old are you is how your price is going to work.
How
Yes,
did the
Jeremy?
how did the prices of those compare to the traditional prices through the Affordable Care Act?
So there is no way to be able to answer that because the Affordable Care Act pricing depends on where you live, what your income is, how many people are in your family, how many dependents you have. So, like when I sit down with clients, we do a full-blown consultation because what might be great for you, Jeremy, is not going to be great for Dennis.
Yeah,
Um,
my question more relates to like how going straight through the ACA, even though like I'm an S corp and I've always just gone through, the Affordable Care Act. I've never gone through a broker to do a group rate down to one. Because according to my accountant, as long as my business is paying the expense, then it's a write-off. So um so basically like for someone like Dennis who was going to take his LLC and ask you like or go through you to figure out what that group rate would be,
mhm.
how do those group rates compare to the individual rates, both Affordable Care Act rates?
So again, there's literally no way to be able to compare that unless we just look like I can look, of course, 2026 plans aren't here right now. And I
Right.
can share with you a link where you can just put in your zip code, your age, and your income and start playing around with all of the plans. I mean, you can get a plan that has a $0 deductible or one that has a $8,000 deductible. The difference between the two plans, though, most generally plans on the Affordable Care Act are networks that are EPO, so exclusive provider organizations. So that means the network is very regionalized. And when you go outside that region, there's no coverage unless you are like on your deathbed. So um, the the personal health questionnaire that you would fill out, these plans would be PPOs, which is Preferred Provider Organization, which is a nationwide network with in and out of network coverage. So that
Gotcha.
is one of the differences. So I know a lot of people really like that PPO safety net. Because if your Affordable Care Act plan is domiciled in New York right now, and you're in Kansas City, you don't have coverage here if it's an EPO plan. I'm not super familiar with all the New York plans and how they're
Right.
built, but most of them here in the Missouri and Kansas side are EPOs. The other thing is you don't know, like if you're a freelancer, you could have an amazing year or you could be struggling. And so I've had people tell me they make, $50,000 a year, and at the end of the year, they make $150,000, and now they owe money back to the government on their taxes. So that's the other thing that people are just like, they don't like that part. And we work with tons of independent entrepreneurs, freelancers, financial planners, realtors, um, lots of 1099 type contractors too. And literally it is different for each person. So, like what if I sat down with you, Jeremy, I'd say, let's look at the Affordable Care Act for sure. Let's fill out a personal health questionnaire and see what that comes back at. Let's look at the pros and cons of both. Maybe one might be more expensive, but maybe the network's better. Maybe your doctors are in network or your medication is covered better. So there's just a lot of different moving parts. And so again, like everybody in this room is unique. And what is great for you may not be great for Ron.
Mhm.
Got it. Yeah, for me, I didn't apply when I got here straight through my business because my business is still registered in New Jersey.
Hmm.
And I've been figuring out what to do, which is probably going to be dissolving that business and starting one completely fresh, just because the expenses make it
Hmm.
for ease of doing the process.
Yeah.
So, but for that reason, I didn't go through my business or even think about going through my business because, like you said, I had insurance when I was in New Jersey, but
Hmm.
I
I
can't
remember we
use
had
that
this
insurance.
conversation a couple years ago.
What's
And for
that?
you, the ACA was the best option for you at that
Right.
time.
Yeah. Yeah. And but I mean, even then, still back then, I was in New Jersey, so I had coverage. When I moved
Hmm.
here, I had no way to even get my meds
Mm.
Yeah.
unless my doctor wanted to, unless they filled the prescription at the pharmacy in New Jersey, and I had a friend go pick them up and ship them to me. So I basically re-registered through Affordable Care Act so that
Hmm.
I could get established with doctors and stuff after here.
Right.
So
Right. And then if you move, you can definitely change that.
right.
One of the things that we do too is we will look at like we have I had a client on the Affordable Care Act. He was in the Blue Cross Blue Shield Spiracare plan, and he had 5 generic drugs with a $25 copay. So we looked up every single one of those drugs on GoodRx, and without insurance paying cash, they were all under $10. So literally saved him $1,000 a year.
Wow.
I've had a gal who needed a spinal surgery. Normally, when I put someone on an Affordable Care Act plan, it's because of medications or they get like a really good price on the Affordable Care Act. Otherwise, most people don't really want to be on it because it's just hard, as you can see. But like we had a gal who needed a back surgery, so we put her on the Spiracare. It was December. She had a $6,850 deductible. She went to North Kansas City to get her spinal MRI. It was $2,500. She called me and she's like, I remember our conversation, our consultation about, other options of how to pay for medical. And she's like, my deductible is going to restart in January. What do I do? So I'm like, get me the CPT codes. I called up there. I acted like I was her and I said, I want to pay cash. And her $2,500 MRI went down to $554. And they were super sweet. They were like, hey, I'll send you the confirmation in the mail and just bring this when you come in. So not only do we try to find the right solution for you, we're also going to help you navigate through that solution because the ACA was the right solution, like the only solution for her at that point. But there are other really good, reputable companies out there that are really trying to make a difference in how we use and pay for healthcare in this country. Um, and there are a lot of them that are not. That I have people come to me that are like sold a plan, and lo and behold, it doesn't cover surgery. Like, what kind of insurance doesn't cover surgery? Like her daughter had to have like an ear, and honestly, like her deductible was so high, I said, go ask what the cash pay price is for that surgery, and it was less than her deductible. But if she uses her insurance, it's going to be more. There's all the middlemen and all the negotiating prices. I mean, you can get a total knee replacement, shoulder surgery, hip replaced for around $17,000, $18,000 cash. But
Wow.
if you see that on paper from KU Med, it's going to look like it's 60,000.
Isn't that
So
crazy?
those are the things that will help you do and help make sure that you are not getting ripped off, no matter what you choose. And again, I would not suggest having anybody in any type of a plan that has a limitation. So there's a lot of limited plans out there. They look and sound and are affordable or cheap, but then they have like a limitation, like we're only going to pay $200,000. Well, if you get cancer, that's not going to cut it. And they're going to drop you the next year. So we really only do offer options that are going to be good until you're 65 years old. We do not want someone in a short-term plan that's a freelancer. If you're between jobs or something like that, yeah, we'll put you in a short-term plan. It's cheap. If you break your leg, you have coverage. But if you want something for long-term, um, there are some really crazy plans out there that have, people have come to us just distraught. So again, you have to be really careful about going to anything that is not on the exchange, because there's a lot of hokey plans out there that people are like have quotas and they gotta, they work for a company and they want to sell them, or that's the only product that they sell. The only things that I would ever put anybody in is something I'd put myself in or my own family members. And I want to retire early. I'm going to have to get off of my husband's insurance at some point, or I want him to retire early. We're going to have to do something independent. So again, like the solutions that I would talk to anybody about would only be solutions that I would put myself in until retirement. And you want that security for your future. Little short-term plans, like I'm meeting a gal here actually at 1:30, and who's a realtor, and she's on a short-term plan. And she's like, it's never, my doctors are never in network. And and if anything ever happens to you and you're on a short-term plan, you're not going to get renewed. So then your only choice is to go to the ACA. So again, you just got to read the fine print. And that's what we do. We're members of the Free Market Medical Association. So it's all like-minded people across the country, surgeons, doctors, brokers, third-party administrators that are really trying to change the healthcare from the bottom up. So you literally have to be the consumer, change the way you pay for healthcare from the bottom up, and then hopefully someone will start listening. Because, I know you don't want to get political, but it's both sides.
Yeah.
Both sides are accepting money from the BUCAs, the Blue Cross United, Cignas, and Aetnas. So
What did you call them? Bukas?
I did. That's what we call them in the industry.
Okay. Bukas. Okay, so it sounds to me like you don't recommend ACA. You recommend working with someone like yourself instead, to find something like, what did you say, Spiria Care or something like
Well, no, I don't not recommend the ACA. What we'll do is we'll look at the ACA because that is going to be a plan that's going to be, full coverage. They're not going to put any limitations on you. I would also, if we did go that route, make sure you knew where the loopholes were so you don't get ripped off. So like it's December and you're getting a spinal MRI and you're going to save $2,000 by not using your insurance. That's where we come in. Or like the guy that has the five, I want to make sure I know what your medications are. We're going to look them all up. I'm going to figure out the best way for you to get those medications, whether it's through your insurance or not. And we work with a medical cost sharing group too, that is not religious based, which has been a great answer for a lot of our independent entrepreneurs, because once you're in until you're 65. But it's not the best answer for everybody. And it takes some education. But again, like there are some good things out there. We also have a couple of other PPO options where if you answer no, it's slightly underwritten. You have to answer no to 11 questions, and then you are able to get this plan, which is a PPO network. You can get HSAs, copay plans, and depending on what your income is, I mean, they're not cheap, but depending on what your income is, they're cheaper than the Affordable Care Act for some people. So again, the answer of, is ACA pricing comparable to any of the other options? I don't know until we actually sit down and have a conversation. But that's what we do. We spend the time with you and we spend time vetting good solutions that we would use for ourselves.
Fantastic.
And our clients are our family, and we're with you along the journey as things change. As you retire or you have a business run with employees. We have a lot of small groups, a lot of them. 50% of our business are small groups. So I'd be happy to look at what you've got going on too. And there's some groups that have been doing some alternative things that are actually giving their employees better health care out there. But a lot of brokers just, they work for a big firm and they can only work with the BUCAs, or, they've got quotas and things like that. We don't have that at all. We're here to actually change healthcare one person at a time.
Nice. Every time I hear Buca, I'm hearing Buca de Beppo, right? Like,
oh yeah. I did not think of that until now.
Yes, that's what I'm
But
hearing.
yeah, any questions? Like I really want to be your resource.
And since everyone is Kansas based, I'm just going to say because I know this isn't a freelance exchange event, but if you are a freelance exchange member, Sunflower Benefits Group is a benefit, and a consultation is only $50 instead of $100.
True story.
I'll plug you because you didn't plug yourself.
No, thank you. Well, I didn't really want to plug myself. I really wanted to be a resource, but it hurts me when people just don't know because you don't know. You don't know what you
Right.
don't know, right?
No,
Absolutely.
I'm coming from, a very democratic state in New Jersey, and I had amazing plans through the ACA because it's a democratic state. And not only was I subsidized by the federal government with that plan, New Jersey kicked in a portion of it as well, because that's how they were set up. And so
Mhm.
I was grandfathered into this amazing plan, and I only screwed it up last year because I misread the application, like we were talking about.
Mhm.
And when they told me what the price was going to be, I canceled that out of ACA before figuring out that I had done something wrong. And when I went back to correct it and then try and select a plan again, they're like, "Oh, but that plan doesn't exist anymore. That was a plan from 5 years ago." And I'm like,
Yeah, well,
"But I
Aetna's
have."
leaving too, so we have all people scrambling because Aetna's leaving the ACA. One of the things too is if we together decide, hey, I think you need to go to the ACA. That's the best route. We have a specialist that we work with that walks you through all that and helps you and holds your hand. And it doesn't cost you any more. There's nothing that's going to cost you more by going through Sunflower Benefits Group.
Right.
You're just going to have us there as a resource. And we have a lot of resources too. If you're in medical debt, if you have a really expensive medication, we have a plethora of resources.
Wonderful. Jen, welcome back to the party here. I am curious. You said you've been on the ACA for what, 10 years?
I have.
Can you share with us like what your experience has been, the good and the bad with the ACA?
Yeah, let me think about that. So I've been on the same plan within the ACA for probably the last 5 years. So to me, it feels like it's stabilized over time because in the beginning, when they were getting things figured out, I was literally having to change plans every year because United Healthcare dropped out and then Cigna dropped out. And, so it was honestly a nightmare to keep up with it. I would say my recent experience has been pretty good. Although in Kansas, the plans are extremely limited, especially if you're looking for one that is HSA compatible, which I am because I want to reduce my taxable income as much as possible. So I have one of, I believe, only two available HSA plans, um, which in some ways is a benefit because otherwise you're comparing 1,000 options, right? Like in some ways, I appreciate not having too many options because I'm not yet working with someone like Mary to help me navigate which one is right for me. So I'm on an HSA compatible plan. And I love that with ACA, my wellness visits are all covered. So things like your annual just health checkup with your primary care provider covered 100%. Your standard blood panel covered 100%. Screening mammograms, colonoscopies, those are all covered. And my plan is pretty unique in that it includes vision and dental as a part of it. And the monthly premium for my plan is much less than it would be if I purchased vision and dental on another plan separately. I'm thrilled that I've had very few problems getting reimbursed, but when you do have a problem, it's really difficult to get help from the company that I use. It's a nightmare of email and waiting on hold on the phone. But I actually track through my explanation of benefits what the full cost of care would be and then what the discount is with my insurance. And then I track like what my annual physical would cost and that blood work so that I can see my savings through ACA. And I will say I'm surprised at how much I've been able to save just by virtue of getting those appointments covered. Now, I don't happen to have, you know, like ongoing conditions. I'm not on any prescription medications, and I'm single, no kids. So I'm a lot simpler than some other people probably are, which probably makes it easier for me. But I would say overall, my experience has been good. But I wasn't kidding when I said I heard a story on NPR last week where they were saying nationwide, they expect people's out-of-pocket expenses for their premiums to go up between $12,000 and $24,000. So in preparation for this call, I went on healthcare.gov yesterday to see, hey, what are my rates going to be?
No,
And you can't see it yet. It's too early. So I'm like, great, suspense, exactly what I want when I'm talking about healthcare, right?
So Jen, I'm glad that you brought up the ACE, like the visits that your primary care visits, your mammograms, colonoscopies, things like that. So any insurance plan that is ACA compatible, all of that stuff, there's like a whole list of preventative things that are included in the price that you pay every month. So anything that like any insurance plan that I would offer you would also be ACA compliant. And then any company that is over 50 employees has to offer a plan that's ACA compliant. So that's kind of the rule of thumb. So, some of the plans out there that I've seen people get enrolled in are not ACA compliant. And again, maybe it's a good fit for a 24-year-old healthy kid for a couple of years or something like that. But when you get up into kind of our ages, you need to have something that's going to be there if you get the big C word or whatever. And then also, just also so when you're looking at like my physical cost, $400, but they're giving it to me for free. If you go and pay cash for a physical, it's around $150. And if you pay cash for labs, they're around $30 or 20.
Wow.
So the prices that you see on paper within any insurance policy, and not just the ACA, I'm talking any group policy, even Ron's group policy, probably I'd have to look at it, but it's a fictitious negotiated price. There is no free market pricing going on there. It's negotiated between the insurance company and the hospitals and the network and the pharmacy benefit managers. And it's a hot mess in that little realm. So the only way you can really get true pricing is if you ask for the cash pay price. And I would always do that, especially if you're on an HSA plan, Jen. Does everybody know the difference between an HSA plan and a normal plan? Okay. So an
That's
HSA
the
plan is
where
really cool because you can
pay,
put,
use it or lose it, right?
no, not on an HSA. That's the flexible spending account. So the HSA, Jen is doing I mean, it's a great tool because you can put money in tax-free and then you take money out tax-free. It grows just like any investment. You have to use it for medical, but it'll be great when she retires. She can use it. You can't use it for premiums, but you can use it for any medical expenses that you have. And I work with people that retire early and they'll have like $100,000 in an HSA account. And I'm like, wow, that's awesome. They've been putting money in an HSA for a long time. Um, but the difference between the plan is anything outside of those services that Jen was talking about that were included in the plan, you will be paying a negotiated network price that will be going toward your deductible. So a lot of times it's a very inflated price. So if you wanted to go see a specialist, your negotiated network price could be $300. That's going to go toward your deductible, whatever it is. But if you're never going to hit your deductible, you might be better off just paying a cash pay price. And then you can go to any doctor you want. You don't have to worry about if it's in network or not. So the other thing I always try to make sure people understand is don't let an insurance company tell you who you can and can't go to. You can go to any doctor you want to go to if you want to pay cash. So if there's a cardiologist that you see once a year and he's not in your network this year, but you're like, I love him, I've had him for 10 years, you can still go to that cardiologist. You just ask him what the cash pay price is. And everybody legally has to have cash pay pricing.
That's good to know.
So yeah, I mean, so even you, Julie, and we also do work with a lot of spouses because for some reason, a lot of them in the school districts, when you add a spouse, it costs like $800. So they're like, my spouse is healthy. Like there's got to be another option. So they'll come to us and go, what can we do with my spouse? The school district's paying my insurance, but when I add my spouse, now that we don't have a family anymore, it's costing me $800. So we work with a lot of people like that too. So even if you have spouse's insurance or your insurance through your spouse, there might be a better answer.
It's good to know. I did see, I was poking around on the Freelancers Union website for the options that they have, or what they recommend. I'm going to post a couple of links here in the chat. And for those of you who are catching the replay, you'll get them on YouTube as well. That first one that I just posted is for free or subsidized plans. There's a whole blog post about it, and you can go in and kind of plug and play your information to kind of get an idea of where you would fall. And then the second one, I guess, is a partner of theirs, Solo Health Collective, that has nationwide PPO plans. And that looks like it says once you've met your deductible, the plan pays 100% for covered services. So I'm going to offer those links as well because those are free on the Freelancers Union website that you could find easily yourself.
I did look at the solo through freelancers, just comparing at it. Which for myself, I'm a 51-year-old diabetic. So the cheapest rate for me would be $580 a month with a $10,000 deductible. You would go down to $2,500 deductible, it was $784 a month. Compared to, I'm currently paying $317 a month. That's with the discount, but whatever, I'm getting some
Subsidy.
Thank you, of $350 a month. So, and I currently have Aetna who's going away from ACA, and I called them and said, "Hey, do you do individual, not on the ACA, just on your own?" They're like, "Nope." I'm like,
You can't
right,
do it.
check that off the list.
Literally can't do it. You have to either so a couple of our options that we have, one of them is you become a 1099 contract worker and you have to take 4 surveys a year, and then you're eligible to get this PPO plan, which is like working for T-Mobile or whatever, like a corporate plan, ACA compatible. And then the other one is you become a W-2 employee and you have to take 4 surveys at $40 an hour to get on their group plan. But these are all PPO plans, but there's ways around it. So and on this one, it looks like you have to be somewhat healthy that you have to answer so many questions or something like that, maybe. Probably kind of the same thing. We also work with, if you, some like realtors have like a realtors association plan. But again, we had a realtor that type 1 diabetic, who was on that plan. She thought she was just stuck. She's like, I just have to do this. The Affordable Care Act wasn't affordable for her, but she was still paying like $1,500 a month for one person on the realtor insurance. So we looking at direct primary care and paying cash for all of her type 1 diabetic stuff, and we put her in medical cost sharing. So it just depends. Like, again, there's no crystal ball perfect answer for anyone. And things change too quickly in this industry. I do think there's some really good changes coming, but not yet in the ACA, hopefully. But there are some people that we work with very closely. One of them is Dr. Keith Smith. He's the founder of the Surgery Center of Oklahoma. First surgery center in the country in the late 1990s to post their prices on the website. They don't take insurance. I mean, you can send it in if you want. But what happens too is when you are in a group plan, so like, Julie, who does your husband work for?
The company?
Yeah.
Oh, it's called Dorco.
Okay. That's cute. So like Luca. I mean, it depends on how big the company is, but let's just say it's Black and Veatch or whatever. That's a self-funded plan. So the way that those employees use their healthcare is extremely important to keeping the costs down. But nobody's educating an employee and saying, maybe you should get your mammogram at Diagnostic Imaging for, $200 as opposed to St. Luke's for $800. It's costing that plan money, and somebody is paying for it, and it's the employer. But then you get a renewal And if everybody went to, KU Med for their mammograms and colonoscopies and, or whatever, the rates are going to go up the next year. So, there's so many ways to maneuver through the healthcare system. And so Dr. Keith Smith was talking to Congress, actually. It was him and Mark Cuban with Cost Plus drugs, and literally talking about the free market. Like there's nothing in this country that we pay for that we don't know what the price is going in. We know what an oil change costs us when we pull in, unless they upsell us the oil and all. But and it was just crazy when I was watching this. It's a YouTube, and it was just a couple weeks ago, and the people in Congress were just like dumbfounded. And I'm like, this is not that hard. He uses cost accounting to figure out how much it costs to do a hernia surgery. I mean, there's nothing more than like $20,000 on his website for his surgeries. And most of them are under 10 or even under 5. It's crazy how and so what's happening now is like big employers are doing direct contracts with, they're getting the insurance out of it completely. They're using custom third-party administrators that are not owned by a Blue Cross or a United, and they make direct contracts straight with, Mercy Hospital System. Like we have a group that has a direct contract with the Mercy Hospital System in Hutchinson, Kansas. So if they go to the Mercy Hospital System, it's a $0 deductible because they're paying basically cash on the back end. And it doesn't cost the plan it costed about a third as much. So it's really complicated. But there's ways to maneuver around it. I don't expect any of my clients to like walk away and know what's going on with the health insurance industry. I just want them to know how to use whatever we pick for them and not get ripped off by the insurance industry.
Yeah.
And I want them to be protected and feel like they have the freedom to go to whatever doctor they want to go to.
Mary, do you work on the Missouri side also?
Mm-hmm. We work actually nationwide. My
Okay.
business partner, Connie, moved to Arizona. So now we're in Arizona too. But yeah, we have clients all over the country.
Great.
Mostly in Kansas City because that's where I know everybody. But yeah, Kansas, Missouri, Iowa, Nebraska, Texas, some out east, not a lot. Yeah, Minnesota, Wisconsin.
All over.
Mm-hmm.
Well, that's
Quick question, not because probably because it doesn't apply to anyone else. Do you also do any kind of international?
No, you'd have to live in the country, but we do have a plan that is nation or worldwide.
Okay.
That's like if you traveled, but you have to have a social security number and be an American citizen.
Are you moving, Dennis? And can you
Yeah.
take us with you?
Not yet. We have a place in Mexico and we go there multiple times a year, and our initial plan is to retire there and move there, but I don't know when that's not going to be within the next year
If it's
that we know of.
if it's Puerto Vallarta, I'm going with you. I love that.
I was gonna say, do you have another room in there?
Sorry, we're already splitting with a friend who lives there all the time, so
It's gorgeous down there. I love
but
it.
you can come visit.
Okay. Noted. Jen, thank you for adding your commentary in the chat here. I think that's really helpful. If anybody else has other tips that they've learned, what works and what doesn't work, please let us know. Feel free to chime in the chat or come off mute and let us know what you have learned.
Yeah, I second everything Mary said about always asking for the cash pay price, because I think my deductible is $8,000. So
Yeah.
unless I get hit by a bus or something really horrible happens, I never hit it, thank goodness, right?
Mhm. Right.
But often I will pay cash if I do need something, because having it go towards my deductible isn't that much of a benefit when you've got essentially a catastrophic plan that's high deductible.
Mm-hmm. Yeah. But I mean, you're doing a great job at that HSA. That's if you were pretty much of a healthy person and didn't have to do a lot of specialists and things like that, that's what I would recommend. Now, they're not that cheap on the Affordable Care Act, though. They're more expensive than some of the other options. But so you have to weigh out the options. There's just so many things that we ask and talk to you about. From medications to how you use the doctor. We'll actually educate you on direct primary care too, which is a fantastic way to get good health care. If anyone wants more information on that, they can reach out to me, but it's definitely the wave of the future.
This is all super helpful, and I love how it's taken a positive slant. I do want to touch on any negative slants here real quick too. Just like, has anybody had a horrible experience, whether it's with the ACA or a different insurance company, anything that we can learn from, and help other people avoid going forward in the future? I mean, if not, good. I just want to be proactive here and help other people learn. Like, stay away from XYZ company, or brokers or whatever.
No, Mary, do you have any specific companies that are on the ACA that you don't recommend? Because
Um,
so right now I'm on Oscar, and I was skeptical about Oscar because I was like, when they first came out, I heard about them when I was in New York, and I was like, I don't know who this company is. But then, I mean, right now I'm on a diabetes specific plan, which I didn't even know existed because it wasn't on the marketplace. When I called to
mhm.
ask someone a question, he said, well, we have a plan that'll cost you the exact same amount of money, and it's diabetes specific.
That's awesome. It was that based out of New Jersey then?
No, that's here. That's the one that I
Okay,
have right
that's
now.
awesome.
Yeah.
So I have had not good experience with Ambetter. They from like when I've talked to people in the medical professional world, they're very slow to pay or they don't pay. Doctors then get themselves out of the network. We're like, we're not taking Ambetter anymore. And so I've seen like when we did Ambetter for a family because he needed this pediatrician and we found Ambetter and it was affordable for him and yada yada. Like 4 months later, he calls up. He's like, my pediatrician's not taking Ambetter anymore. I'm like, well, you can either change pediatricians or just pay cash. I mean, there's nothing you can do. Um, so I don't normally look at Ambetter just because had not heard anything great about it. And then United sometimes with a medication. So depending on your medication, I've had them take like if generic medications come out, they'll knock people off of the name brand and make them try the generics before they'll go up and pay for that name brand again. So then they're having to do this tiered system, if they've been taking a medication for 5 years and it's working great. And then so they just do a lot of funny little things like that.
Right.
Let's see, I have Amber and they can be slow to pay providers. Yeah. Yeah. That's what I've heard. And like I talk to so many different people, but just people in the medical field that when the patients come and they have Ambetter, they're just like, because they don't pay or they're really slow to pay.
Sure.
So, but
Dennis,
again, I mean, it just kind of depends what you have going on. If you have a lot of stuff going on, you're going to specialists and all that kind of thing, then, it's just going to be more difficult.
Dennis, I'd be curious if you had heard of Oscar or if you wrote that down here and go look it up now, since it sounds like you two have something in common there.
Uh, I've heard of I guess I've heard of it only because I'm sure it was in one of my options at some point on the marketplace. I've never had them. And it was interesting to know that there was a plan available to you but wasn't listed.
So
That
Oscar
seems
is in
ridiculous.
Missouri and not in Kansas, if I'm remembering right.
Well, I'm in Kansas, so
Oh, you're in Kansas? Okay, maybe it's
yeah,
the other way around.
yeah, and so yeah, so the diabetes specific plan wasn't on there, and this year for my renewal, it said that it's something that I got said the plan was going away and they were going to throw me into a standard plan, but I'm not really sure if that's true, if the plan's going away or if they're just trying to throw me into this other plan that's more expensive that I was going that it's basically the one that I had thought I was going to sign up for before I talked to someone, who told me, well, why don't we put you in this plan? Because when I signed up through the ACA, I signed up for the plan that I thought I was going to have, and I had to call and ask a question. And when I called to ask that question was when the guy said, "Well, we have this other plan. Why don't I just shift you to that plan? And it's still the same price." So
Huh.
I don't know if the diabetes plan is going away. Specific is going away. But yeah, it was something that like I had no idea until I made a phone call even was available. But it's nice. I mean, been nice to have for 4 months because
Did
I
that
know
give
that,
you like, did it have like a better coverage for monitors or what? Like what?
well, it's better. I would say probably better coverage for, meds or a wider variety of meds. But also, for a diabetic, we don't necessarily need vision coverage because vision is medically necessary for a diabetic. So that plan would pay for my eye exam from an ophthalmologist every year.
Okay.
And Dennis, if you don't know this, it's been like that for as long as I've been a diabetic, where it's considered medically necessary and your medical insurance covers it as opposed to vision insurance.
Did not know that. Would love to save that $150 a year.
Right. Well, and for us, it's an ophthalmologist, not an optometrist, because they have to do a diabetic eye exam, which is why the insurance companies cover it. As far as the other thing, I think it's just either lower cost or lower deductible, so that you're paying less out of pocket for your yearly visits, because you are required, at least I am, through my doctors, I have to have I have been having 4 doctor visits a year with 4 sets of blood work. My new doctor here, basically said, well, let's start on that. And based on where your A1C is, I might say you don't need to come in for 6 months. But, for as long as I can remember, I've been going 4 times a year and having blood work done 4 times a year so that we can check my A1C.
Good. I'm glad that's nice.
Yeah.
Ron's got a question in the chat. Any thoughts on seeing a naturopathic doctor versus traditional doctor? Typical cash pay. I've been to a naturopath and it was super expensive. I can tell you that. I want to say it was like 350 or something. And then I didn't go back because I didn't want to pay that money out of pocket going forward. But that's my own personal experience.
Um, Kind of to piggyback on that, and I mentioned it, does anyone know what a direct primary care doctor is?
Direct. How is that different?
Direct primary care.
We had a
like
lunch and learn
that-
for the Freelance Exchange on one of those years ago. I don't remember. It was over at what's now Summit Grill. I don't know what it was at the time, but
Gentleman, right, with the curly hair.
yep, you got it.
So direct primary, I'm trying to think of who that might be. It wasn't Dr. Tony Burns or Troy Burns, was it?
Oh, I'll look it up.
Partners.
Mm-mm.
So direct primary care doctors are doctors that have left like being a KU med doctor, St. Luke's, and they open up their own clinics, and you pay them a monthly price every month, and you have access to them 24/7. So and they only take about 500 to 600 patients as opposed to 3,000. And I was talking to somebody last night, and she has to reschedule her KU Med doctor visit. And she's like, I can't even get in for like 9 months. And she's got a medical condition that she needs to see this doctor for. So she's highly looking at doing a direct primary care doctor. And they're usually around maybe $80 to $100 a month. But you literally have access to them 24/7. Like my mom goes to one, she's on Medicare. She goes to Live Active. And I took her down to Arizona and she forgot one of her meds. And I'm like, just text Dr. Ahmed. It was a Sunday morning. She texted Dr. Ahmed. Within 15 minutes, he called in her prescription down the street.
Wow.
Connie, my business partner, when she lived here in Kansas City, she went to Health Suite 110. She was getting her hair done on a Saturday. She had this like big kind of growth on her ear. So she had the hairdresser take a picture of it. She texted a picture to her doctor and said, do I have cancer? What's my diagnosis? And she's like, it looks like a lot of dry skin. Let's keep an eye on it and call me next week. So I've seen them save lives. I've seen them keep people out of the ER for just, serious stuff, but not that you have to go to the ER for, and then they really get to know you. They can get you in for a physical next week or tomorrow, and they spend like 30 to 60 minutes with you. So, and I can, if you want to send me everyone's email, I can send you a list of them here in Kansas City that we work with. A lot of them are our clients. A lot of our clients go to them. They send us people all the time that are in need of, catastrophic, because you still, you can't just do a direct primary care. You got to have your catastrophic stuff. But They're amazing if you want really good healthcare, and especially if you're a diabetic or have any type of a diagnosis, they're really good at overseeing that and being your quarterback through that process. And they really do look at the whole picture and not just give you a drug to fix your problem. I mean, they will talk about your stress, your sleep, what are you eating, all the things.
Is direct primary interchangeable with concierge, or are those different things?
They are similar, but they are not the same thing. Concierge doctors still take insurance, and basically and it's usually more expensive. They kind of bump you to the top of the line. So, you can get in tomorrow if you pay the concierge fee, or they might add in like extra testing and things like that. Like every 6 months, you can go in and do a stress test or whatever. That's included in your concierge price. So we work with the true direct primary care. And it's kind of crazy. Like in the past, like 3 to 4 years, well, probably 3 years. I mean, I've met so many different doctors that have just left. Like they can't handle seeing 25 to 30 patients a day anymore. They just don't get to do what they went to school to do. And they're so happy. And they're probably taking a pay cut, but they actually get to be a doctor that can make a difference and spend time with their clients.
That's great.
There's one called Up Care Clinic that includes dental. She married a dentist, and it's $100 a month.
The things you learn.
I know all kinds of fun little things that a lot of people don't know.
You do. Well, we are out of time, folks. I want to thank you all for joining us today. I'm sure we could talk for hours on this conversation. And Mary, thank you so much for joining us.
You're welcome.
Helping answer our questions. I'm sure you'd be willing to take questions if anybody wants to reach out. Her contact information is in the chat. And again, those of you catching the replay, I can get that to you as well. Any other last minute thoughts or questions before we head out for the day? No? All right. Well, I will see you in the group and stay tuned for our next meetup.
Oh, and Jeremy, send me that information.
Yep. Gonna do that right now.
All right. Thank you, guys.
Thank you, Julie.
Have a great day.
Bye.
Thank you.
Thank you.
Bye-bye.
Bye-bye.